Now let's talk about Ren 1, Huiyin, meeting of the yin, a Sun Si Miao ghost point. Ren 1 is located in the center of the perineum. How to find? In women, it's midway between the anus and the posterior labial commissure. In men, midway between the anus and the scrotum. Needling vertically 0.5 to 1 Sun. Caution, contraindicated during pregnancy. Some classic texts prohibit needling this point. Particular attention should be paid to the prevention of infection. Actions, indications, clears heat, strengthens the kidneys, and drains dampness. Regulates menstruation. Special features. Meeting point with the Tumai and the Chong. As a Sun Si Miao ghost point, Ren 1 is traditionally indicated for treating epilepsy and psychosis. Regulates the two lower orifices and genitalia and resolves dampness for difficult urination and defecation, enuresis, impotence, pain in the penis, sweating of genitals, swelling of testicles, swelling of vulva and vagina, prolapse of rectum, hemorrhoids, pain in anus, pain in urethra, itching, and pain of perineum, hernial and genitourinary disorders. Ren 1 promotes resuscitation for coma, unconsciousness from drowning, calms the mind and opens the mind's orifices for manic depression, nourishes yin. Ren 1 is the point where the three extraordinary vessels, directing, governing, and penetrating vessels, the Renmai, Dumai, and Chongmai, emerge from the interior. For this reason, it is a dynamic point with a powerful action in moving qi and blood, and also in subduing rebellious qi, as in mental problems. Some of its indications, epilepsy, manic depression, hemorrhoids, prolapse of anus, reflect a governing vessel pathology. Ren 1 resolves dampness in the genital area and in the urethra and anus. It can be used for vaginal discharge, pruritus vulvae, or itching of scrotum, urinary difficulty, and difficulty in defecation. As one of Sun Si Miao's ghost points, it calms the mind and opens the mind's orifices, and it can be used in manic depression. This point also nourishes yin and benefits the kidney essence. It is used for incontinence, enuresis, and nocturnal emissions deriving from yin deficiency. It is an empirical point to promote resuscitation after drowning. Ren 1, under its alternative name of Ghost Store, is one of the 13 ghost points of Sun Si Miao used in the treatment of epilepsy and mania disorder. The supplement to the 1,000 ducat formulas, in fact, specified that in men, Yin Xiaofeng extra should be needled, while in women, another extra point called Yumen 2, located at the posterior labial commissure, should be needled. Both points more or less correspond to Huiyin Ren 1. Ren 1 is entry point, general junction point, ghost point, crossing point of Renmai, Dumai, and Chongmai, master point of the whole body, first aid for near drowning. This point resuscitates and tonifies the patient, particularly if work on the other officials hasn't brought about the change you expect, rarely if ever sedated. For people who are drowning spiritually when overwhelmed by life, it calms the spirit. Ren 1 is like a last resort before a person gives up the ghost. It is anatomically opposite to Do 20 or 100 meetings, the meeting of all yang meridians, helpful for hemorrhoids and painful disorders of the vagina or penis, regulates menstruation, and energy block may occur here after giving birth. Because of its location, this point is commonly underused. So we use Ren 1 for resuscitation for both body and spirit. It is an empirical point for resuscitation after drowning, but is more often used when the person's spirit is submerged and overwhelmed. Ren 1 is located at the polar opposite to Do 20, where all the yang gathers with similar unifying effects on the officials. A point of resurrection when the person seems deluged by life, a specific trauma, or just worn down by the taking on of responsibilities. This point goes directly to those early but heavenly influxes in us and summons all the wisdom and strength of those influences to raise the drowning spirit. Meeting of Yin roots and calms the spirit. The conservation of yin and essences in the depths provides an appropriate environment for the presence of the spirits. This point can root us into our yin, providing the quietude so necessary for the heart. This ability to study the spirit can help balance a person suffering from florid mania or epilepsy and warrants its inclusion as a ghost point.